Hi. Okay, this is a weird little angle, but I want to show you how to assess your own diastasis or abdominal separation. So let's lie down on your backs and show those bellies and let's measure things out. So first of all, remembering that diastasis happens to everybody who's growing a baby. It is a normal adaptation of the two belly muscles, the rectus abdominis muscles, widening apart, kind of stretching apart as your belly gets bigger. And we're really trying to measure two things. Three things. One, how are your ribs setting, right? So are they still super flared? Are they moving as you engage your core? What's happening? Two, what is the distance between these two rectus abdominis muscles? So we'll do a little curl up. We're gonna test how many fingers can you fit from side to side. And third is, what's the tension in the midline when I do my curl up? Because when I engage my core, ideally, all of your layers are engaging. So your deep transabdominis muscle engages and pulls that midline taut, which helps block the space between the two rectus abdominis muscles. Keep in mind, these two muscles should never be touching. They never were, they never will be. There's always a little bit of space with connective tissue, and that's called the linea alba, but we want it to be stiff so that pressure doesn't push through, okay? So first off, I want you to do a little bit of like poking around, seeing what muscles are tight, if anything feels tender. That can all be good signs about what muscles are overworking, / if you've had a C-section, it's really common to have some abdominal tension postnatal. Seriously, belly massages should be more popular because they really help with circulation. So just kind of getting a gauge for where things are at, okay? I have really tight obliques, that's why I'm pinching here. Okay, then you're gonna place your hand right like this through the midline. And I have 3 spots that I check. Right below the ribs, right above the belly button, and right below the belly button, okay? So right above the ribs, I want you to curl up. Don't engage anything intentionally, just lift your head up and notice, okay, there's one rectus abdominis muscle, there's another one. How many fingers can I fit? How deep and squishy can I go? Okay, let it go. Move a little bit lower, try that again, curl up. Now, obviously I'm not a very good example. I film Frank stuff all the time, so my diastasis shouldn't be present, but sometimes I do things and I'm like, oh, there, like we all can have that gap. It just depends, especially there when you're postpartum. So, okay, last one, you're gonna curl up at the bottom, seeing how many fingers can fit in the space, and what's that midline tension. That's the baseline test that I usually keep notes on, okay? So we're looking for ideally under 2 fingers because more than 2 is the diagnosis for diastasis. But if you're more than 2, please don't be alarmed. That is normal, your core should be coming back together. If you're more than 2 and you're like 6 months postpartum, pelvic floor physio could be really helpful regardless of where you're at, okay? Pelvic floor physios can really help figure out like, why is this diastasis lingering? So second test I do is let's go through our core recruitment cues and see if that changes as you assess again. So I'm going to breathe out, do a Kegel, and curl up. And notice like, okay, usually there's more flatness in the midline, more tone. Option number 2 could be, imagine I'm trying to hug my hips together or zip up a tight pair of jeans and then do my curl up. Does that improve my situation? Maybe for some people, and I want you to be trying these cues as I talk to you, as I curl up, can I think about drawing my ribs towards my midline and curling up, and that will really help the diastasis. It's more at the top. So depending how your body is, depending how your recovery is, depending on what's recruiting more, everyone's a bit different. But our goal is to assess what it's like at baseline without trying anything, what it's like when you use a cue to engage better. If it makes it better, then that's the cue I want you to use when you're doing your workouts, because that means that's recruiting those deeper layers more, and that's what we need to train. And then third is it changing over time? So after you've done that 6-week rebuild, check it out again. But if you can come see physio, come see us so we can make sure that we're releasing anything that is adding to your diastasis, such as abdominal tension and oblique gripping or rib flare, back tension, posture. Okay, that's it. Bye.